Incredibly common. Men talk about it, seems to happen more often to older men. So let's stop right there. Let's get a question on that. The thinking process is it happens more often to older men. Is that fact or fiction?
Fact, but erectile dysfunction knows no age limit. Every man at some point is going to develop an episode. They're going to go through an experience where all of a sudden they're in the heat of the moment and their erections either aren't rigid enough, they can't get an erection, or they lose it, the erection, during the actual, while they're performing. And so I'd say, yes, you tend to see it in the older populations because of the increased comorbidities and the increased risk of developing erectile dysfunction due to those comorbidities. But I think this is a disease that really knows no age limit.
So what are the markers then to a patient that tells the patient that they need to have this looked at? Because let's face it, sometimes it doesn't make a difference whether it's ED or other conditions as well. Sometimes we panic when it comes to certain things, and we have our heads filled with all sorts of different ideas. Mm-hmm. So from the patient's perspective, other than just not being able to perform on a regular basis, when should he say, I got a problem? What's the markers? What's that indicator?
This is a clinical diagnosis. So there really is no specific blood test or test that we usually order to diagnose somebody with erectile dysfunction. There are tests and there are blood tests that we order, but it comes down to the patient saying, I have a problem. And that's, to me, good enough. It's a clinical diagnosis. With that said, other things that men should look out for. It's normal for a man to have nocturnal erections or erections while they're sleeping, when they wake up. It's normal for a man to have the desire to want to have sexual intercourse. It's normal for a man to be able to achieve an erection and maintain that erection for the entirety of sexual intercourse. And so if any man is having any difficulties with any of those things or any other problem sexually, whether it be orgasmic dysfunction, ejaculatory dysfunction, that's when you really want to get checked, because there may be some other underlying issues there.